Welcome to this video tutorial I call Master the miLOOP. It will be a series of 3 cases that I think demonstrate the capability of this instrument. Here, case 1, you see me open the loop, and then I'm going to do something that I think is really useful right there. I open my grip, release it, and allow the instrument to rest on the dorsal thenar space. By doing this, it self-centers. Then I can slowly move it around there. You can see the wire coming around the back. I go a little bit past 6 o'clock, then dial it back to the 6 o'clock location. And then using a two-handed technique, I like to use the actuator. I find this allows me to really control the tip and have a nice smooth actuation. Then we go around a second time. Notice there's a little auto rotation of the nucleus when you do that. Again, release the grip, allow the instrument to self-center, and then begin the rotation. This is really important because if you're not exactly on axis and you start rotating, it is possible to start tearing zonules and disturb the capsule. Here in case 2, I'll show it again. This is another small pupil pseudoexfoliation case. Actually, I think they all are. And once again, we're going to open up the loop and watch how that proximal wire will grab onto the nucleus and rotate it. It turns out it rotates at about 90 degrees. Now watch this next move. I stop and I release my fingertips from the instrument and allow it to sit on the dorsal thenar space. That allows the device to center itself, XY, so that I can do a smooth rotation and I'm not disturbing zonules. You can see a nice rotation all the way around the back, and then we actuate. And now we're going to do it again. So watch this. As the wire opens up, the proximal wire grabs the nucleus and rotates it about 90 degrees. I extend all the way, but right there, I release and let it self-center. Then I re-grab and then do the rotation. That little maneuver just allows the instrument to center itself and make sure I'm rotating on axis and not distorting zonules. I'll show you on the next case. Same thing. Another pseudoexfoliation, small pupil eye. And this one was so small and so shallow, I was uncomfortable even working without first getting rid of some of the anterior cortex. There's a little handoff maneuver with the viscoelastic. Thank you, Uday Devgan and Ike Ahmed. So I put the miLOOP in, and once again we're going to open it all the way, but I'm not going to rotate until I do that little pause and release the instrument and allow it to just rest and self-center. So there it is right there. Then I re-grab and start the rotation. Wait nice and slow. Wait for the flash to see through the back. And there it is. Now I know where my wire is. Rotate a little bit past 6 o'clock and then slowly bring it back. Now, two-handed technique. I really prefer that. Actuate the wire, cut right through. In this particular case, I was so shallow, I was uncomfortable doing a second sweep, so I filled it up with viscoelastic. Then I went and did my sweep. Rotated it vertical. You do not need to actually rotate with anything, but if you start vertical, what you'll see is as the wire opens up, that proximal loop will engage the nucleus. It will rotate 90 degrees. I don't think this was intended by the engineers, but it's just brilliant and works beautifully. There's the full extension with my release. Then using 2 hands for excellent control of the tip location and smooth actuation of the wire. Bring it through, complete the second section. Now for this one, I'll show you what a typical phaco looks like when we've done the quadrants. It really is very straightforward because everything's opened up all the way. And we just need to put the tip right in the center of the eye and take the quadrants out. It's extremely straightforward and just a fantastic way to do pseudoexfoliation eyes, post-trab, extremely elderly, all of these high-risk eyes that we really don't want to stress the zonules. This is an absolute brilliant instrument, and I use it all the time. So there we have it. The release is really the key to making a nice, safe sweep. Thanks to Pat for the photo. And the key points here. Rotate the nucleus with the proximal wire, release to self-center. I like the two-handed technique, really prefer it, and rotate slow and easy. Thank you very much.